This is all from my side today. Thank you and take care. Hello everyone, myself Dr. Komal, and I am an Ayurvedic practitioner with specialization in gynecological disorders and Panchakarma. So, being a part of Pure Bliss Akram is a big deal for me as it's a platform where we all have decided to take Ayurveda across the world. Because as an Ayurvedic practitioner, I have seen a lot of times that people in various corners of the world don't even know that Ayurveda exists and what exactly the Ayurveda is. It's a traditional science of medicine, which has like a lot of treasure in it in terms of all the diseases. So, uh, in being a part of Pure Bliss Akram, I have taken this initiative along with a few other members to spread the awareness and to reach each and every corner of the world so that anybody who is in need of our Ayurvedic consultations or Ayurvedic knowledge to treat the disease, we could be a help of that person. So, to initiate this website, to initiate this virtual clinic, with the grace of God, we have been working on this since many months, and now finally we are here with our presentations. So, this is my first presentation for you all, and for today, I have selected this topic. Being a gynecological expert, I have selected this topic of menstrual abnormalities, where we will be discussing a journal, uh, menstrual abnormalities, and in the coming webinars, we will be discussing detail wise each and every abnormality. So, with this, I'll be starting my webinar for today. I hope you will be like it and it will be a help for all of you. So, it's menstrual abnormalities. In this, we'll be getting to know the different menstrual disorders, which includes amenorrhea, infertility, leukorrhea, pelvic infections, and many more. So, what is Ayurveda, and what does Ayurveda do? How it is different from other sciences? Ayurveda attributes a great importance to food and proper nutrition, as Ayurveda considers food as one of the three pillars for a healthy and a successful life. Food is one of them. So, Ayurveda attribute a great importance to the food and the nutrition that we take on a daily basis. It is the nutrition that is responsible for the development of both physical aspects of the body as well as mind and emotions. So, I think a few of us only will be able to relate this thing that how the nutrition is related to the physical aspects of the body as well as mind and emotions. As we all know that our whole body is made up of food cells, right? The food we are eating since we were born. So it's the collection of food. It's a heap of food is there inside us, which keeps us alive. It keeps us healthy. But the main thing is what you are eating. It's not only that are you eating or not. It's the main thing is what you are eating. Is it healthy? Is it good for your body or not? Because that food not only affects your physical appearance, your weight, your height, your proper development of the organs at mental level and physical level, but it also affects the emotions, the mind, which nowadays plays a very important role in one's life. So, what is menstruation exactly? Word menstruation. Menstruation is bleeding from the vagina that happens about once a month. It is a normal part of the menstrual cycle. It is also known as having a period. So, for most of you, this menstruation might be a common word. This period, as we all know, we call it on a daily basis. But there is a cycle called menstrual cycle, which have 3 or 4 phases, and this menstruation is one of them. That's why I have just started with this the definition of menstruation, menstrual cycle, and we'll be going towards the detail of menstrual cycle later on. Periods usually come between 21 and 35 days apart. This can change from cycle to cycle. You can work out your menstrual cycle length by counting how many days there are from the first day of your period until the first day of your next period. That is the duration of your menstrual cycle. Whenever you'll be going to a gynecologist, she or he will be asking you basic questions, and one of them will be how long is your menstrual cycle? Like how many days is there between your two periods? So it can vary from 21 to 35 days. Few patients can have it on 21 days interval, some can have it on 30, or so, someone can have it on 35 days. So it's an average that I have written here. The menstrual cycle gets your body ready for pregnancy and is controlled by hormones that come from your brain and ovaries. So basically, I have mentioned here what is menstruation, what is menstrual cycle, and now what does menstrual cycle does in your body is that why it is important, why it is required for a female to get menstruation on time and on a regular basis is that whenever you got menstruation, it means that your body is preparing yourself for the pregnancy in case you are married. But it doesn't mean that menstruation will happen only in that case. It's just an indication that you are having a healthy reproductive cycle and it will be easier for you to get pregnant whenever you plan to. So, this is something I'm trying to make you understand because all of you are not medical students or with medical background. So, I'm trying to tell you in very common language, and it's controlled by hormones. So this cycle is basically controlled by hormones. Whenever a patient comes to me and tells me that her menstruation is irregular, or some patients will say it's heavy bleeding is there, some will say very scanty bleeding is there. So it just vary patient to patient. So the main role played here is by the hormones. Whenever the hormones are disturbed, there will be irregularity, there will be disturbance in the menstruation. And those hormones are derived from your brain, basically from your pituitary gland, that is the master gland of your body. And secondly, from the ovaries as well. So there are few hormones secreted from the brain and few secreted from the ovaries. So this is the picture that I have added, and you can see this is the menstrual cycle, and we'll be starting from here. First, the menstruation will be there. Then, with menstruation, when you see the bleeding, the blood coming out, it is the endometrium that is being shedded, which was prepared for the menstruation. Endometrium is shed in the form of blood, clots, and everything. And then again, when your menstruation ends, egg will be matured, and this is the best time to get conceived because there is the availability of egg. Whenever you will be sexually active, when there will be intercourse, sperm will come and meet the egg, and you can just conceive and get pregnant. After that, egg is released. So this process will be of 28 days cycle on an average, and then again, if the sperm is not there, egg will get destroyed, and then again it will start preparing self for the new endometrium. So that in the next cycle, endometrium will be prepared for shedding in the form of bleeding. So this is how a brief menstrual cycle is explained. In the last, I'll be asking you some question, and if you have any doubts, we can just discuss it and make it clear to you. So this is the main topic, menstrual disorders. Until now, we were just discussing about what is menstruation, how does Ayurveda uh, think about menstruation, and what is a menstrual cycle. And now we'll be coming towards menstrual disorder, various menstrual disorders. So menstrual disorders are a disruptive physical emotional menstrual disorders are a disruptive physical and emotional symptoms just before and during menstruation, including heavy bleeding, missed periods, and unmanageable mood swings. I think you might all have experienced it. Most of you have experienced it, this unmanageable mood swings. So, what is menstrual disorder? This is the definition that these are the disruptive, like this is very disturbing. As the name suggests, this is a disorder. Any disorder which is there will be disturbing. It is disruptive in terms of physical because your physical body gets disturbed. A lot of symptoms will be there: bloating, pain in the abdomen, pain in legs, and sometimes headaches will be there. So in this way, physically you are disturbed. Then emotional symptoms because you are getting a lot of mood swings. You will sometimes you'll be so happy, sometimes you'll be so sad and angry without any reason. So when does these symptoms occur? Is that mostly it is before the menstruation and during menstruation as well. So that's why we call it as premenstrual syndrome as well. Before the menstruation starts, you will be getting these symptoms, which is an indication that soon you will be getting your period. So, what are the common symptoms that patients tell me? One is heavy bleeding. Sometimes patients told me that I have been suffering from heavy bleeding since many days. Normally, what is the duration of the period is 4 to 5 days, but sometimes patients experience it for more than 10 or 12 days as well. So heavy bleeding is one of them. Missed periods, then unmanageable mood swings. So these are the menstrual disorders, and basically the indication that you are suffering from menstrual disorders. Some women get through their monthly periods easily, with few or no concerns. Lucky you. Their periods comes with clockwork, as their biological clock is set exactly on time that the same date of every month they will be getting their period. Their period comes like clockwork, starting and stopping at nearly the same time every month, causing little more than a minor inconvenience. It's just because there is something going on in your body, so it's natural that you'll be feeling different from the other days as well. So you might be thinking that how does it depend that someone is having a very normal and a healthy monthly period and someone is having a lot of problems with their period. So it all depends on a lot of factors which we will be discussing in this webinar later on or in the coming webinars as well. However, some other women experience a host of physical and emotional symptoms just before and during menstruation, from heavy bleeding and missed periods to unmanageable mood swings. These symptoms may disrupt a woman's life in many ways. As I have explained you, it can affect your life both physically and mentally and emotionally as well. So now here comes the doshas. Ayurveda is all about doshas. That is vata, pitta, and kapha. You might have heard a lot many times, maybe in our previous webinars as well. So in every webinar, you will be listening to these words. So I want you to, understand what is dosha and what is vata dosha, what is pitta dosha, and what is kapha dosha. So that it will be easier for you all to understand whenever I'll say vata predominant, whenever I'll say vata symptoms or pitta symptoms, kapha symptoms, kapha dosha predominant. So these terms will be familiar to you. So now I'll be explaining the menstrual cycle according to doshas. Whenever I'll be giving you a webinar, I'll be correlating each and every disease with the doshas because without these doshas, nothing is there in Ayurveda. We can't make diagnose, we can't make treatments. So these are the building blocks of any Ayurvedic uh, practitioner. So first is if Vata is predominant in a female. So what kind of symptoms that female is gonna see, gonna experience in her periods? If a female is Vata predominant, she will be having cramps, pain during the periods, Low backache, pain in calf muscles will be found in that female. So it's just a classification for the doctor that if the patient is having vata menstrual disorder, pitta, or the kapha, so that we can plan the treatment accordingly. Secondly, pitta. If pitta is predominant in a female, then there will be profuse bleeding, heavy flow, rashes, acne, tender breast, and irritation. Because these symptoms you might be correlating that a person with high pitta or high heat in their body will be experiencing these symptoms. Third is kapha. If kapha is predominant in a female, then heavy breast, edema, white discharge, swelling on the ankle. They love to eat chocolates, don't want to go for work. So these signs will be found in that female who is kapha predominant. So this is a journal diagram for female reproductive system, just to give an overview so that it is set in your mind whenever I'm talking about the fallopian tubes, the uterus, the ovaries, the cervix, vaginal canal, endometrium. Just I told you before this slide, endometrium is being shed during your menstruation. So I just want you to know these terms so that we can so that it can be easier for you all to understand whenever I'm using these terms. So the main thing is the uterus, which is the main place where the baby is implanted after you get pregnant. Then comes the fallopian tubes. These are the carrying areas where the egg is being traveled to meet the sperm. Then comes the ovary. These are the main structures from where the egg or the female egg is released. Then comes the cervix, that is the opening to the uterus. And then comes the vagina, that is called the birth canal, from where the baby is being delivered. Then comes the endometrium. This is the layer of blood that is being prepared so that you can get menstruation. And the thickness of endometrium is of great importance, which I'll be telling you in the coming webinars. Then is called the fimbriae. These are the finger-like projections which keep on moving and help the ovary to release the egg. So the next thing is these are the basics of menstrual cycle. As I have told you today, this is an introductory webinar for all the gynecological webinars, so that there will be some basic terms you all will be knowing before I go into deep and into scientific terms. So what is the meaning of menstrual cycle? Time from first day of a period to the first day of the next period, as I have told you earlier. What is the purpose? To prepare for possible pregnancy. As I told you, it is important. If you want to get pregnant, you should have healthy menstruation. Length 21 to 35 days with 3 to 7 days of bleeding. This is the gap between two menstrual cycles, 21 to 35 days. And 3 to 7 days is the period of is the duration of the period, once a month. So what is the duration of this menstrual cycle? It starts at the age of puberty, whenever you are 12 or 13 years of age, maybe before that as well sometimes, up to menopause. Menopause is the end of your menstrual cycle. So this is the initiation and this is the end. Between this is the period of between where you are being called as reproductively active or sexually active. And because after menopause there will be no release of the egg and a woman cannot get pregnant after that. So now there are various types of menstrual disorders that I was telling you in the first slide. So a few of them I have mentioned here with a brief description, and later on we'll be discussing it in more detail. First one is abnormal uterine bleeding. What is it? Excessive or prolonged menstrual bleeding. Like what normally is the menstrual bleeding is, as I have told you, 3 to 7 days. But when it is excessive, like quantity wise also it is more, and prolonged duration wise also it is longer than the usual. So this is the abnormal uterine bleeding. This can be excessive, this can be scanty, this can be prolonged, this can be short. Second is amenorrhea. Amenorrhea is a very common word which is used for the absence of menstrual bleeding. because I have seen a lot of patients who amenorrhea is of two types basically. This is physiological as well as pathological. What is physiological amenorrhea? Physiological is when your menstrual bleeding is stopped because of a physiological action going on in your body. Like when you are pregnant, you do not get your periods because that is a physiological amenorrhea. Your body is indulged in some other activity and feeding the baby, taking care of the baby. So you will not get periods during that time. But as a menstrual disorder, amenorrhea is pathological amenorrhea where uh, females of very less age are seen with menstrual bleeding not coming on time or not at all coming. Maybe they will just skip a month or two or more than that as well. So that is the amenorrhea, missing menstrual bleeding or the absence of the menstrual bleeding. Third is oligomenorrhea. In this, you will be having light or infrequent menstruation. As I have told you, abnormal uterine bleeding is heavy bleeding more than the normal. Oligomenorrhea is light or infrequent, like you will be having periods or bleeding for 1 or 2 days, that too not much bleeding will be there, very scanty bleeding will be there. So that is a menstrual disorder named as oligomenorrhea. Then comes the fibroids. These are the known cancerous uterine tumors. It is a very common menstrual disorders I have seen in last few years, and a lot of factors are responsible for it, and it's a very wide topic that we will be discussing in the coming webinars. So the next is premenstrual syndrome, physical and emotional discomfort prior to the menstruation. I think we have discussed it as well before. Next one is dysmenorrhea. This is the painful periods. I think most of us experience this thing of painful periods, and it's a matter of concern. And I'll be helping you with deal with it in the coming webinars as well. So the next one is common predisposing factors of menstrual disorders. What are the factors that is responsible for the menstrual disorders that I have just explained to you? I have mentioned to you a few of them. What are the causes? What are the predisposing factors which are responsible for these disorders? Because there have to be something which is going wrong with us, or which we are doing wrong, which causes these menstrual disorders. And among them, few of them are: first is improper diet. I think you might remember that my first slide was Ayurveda attributes a great deal to the food and the proper nutrition. So here comes that. That improper food or improper nutrition or improper diet is one of the biggest factor responsible for these menstrual disorder nowadays. Second is mental tensions, stress, anxiety, which is very common. Either it is a male or a female, which further is responsible for the menstrual disorders. Then comes the poor personal hygiene, sometimes due to being very busy or many other factors. Females are not able to take proper care of their personal hygiene, which leads to a lot of infections in the vagina or the uterus. Then comes the lack of exercise. Because of this hectic lifestyle, sedentary lifestyle, there is a lack of physical exercise nowadays in our lives, which leads to these menstrual disorders. Next is abortions. Abortions can be because of a lot of reasons, like when there is unwanted pregnancy, the couple get their baby aborted themselves. Sometimes because there is abnormality with the pregnancy, in that case also there is abortion. So like this, there are a lot of factors responsible for abortions, and ultimately abortions, multiple or habitual abortions, leads to these menstrual disorders, because this is not at all healthy for the uterus or the reproductive organs. Then comes the injudicious use of contraceptives. Again, because it is becoming very common nowadays that when you have a lot of options of a particular thing, like nowadays we are having a lot of options for contraceptives. So people are just using it blindly without having proper knowledge of how to use it, which one to use it, which causes a lot of menstrual disorders in females. Injudicious use is like whenever you are using it without having knowledge, without proper consultation from your doctor, This can cause a lot of trouble in your menstrual cycle. Then comes the hormonal imbalance, that is also a very important factor. And last one is the obesity. Look, everything is here is disconnected. When you are having a lot lack of exercise, you will be getting obese. And that's a very common thing. A common person can understand. So these things are all related to each other. So you need to understand that there's need to work on each and every causative factor. It's not like you just have to improve on one thing, you have to work on each and all the predisposing factors to get a healthy menstrual cycle. So here I have just mentioned, and I'll be reading it for you. These are the Vimena recommendations. In the communities where Vimena works, girls and women frequently ask about menstrual irregularities. Clearly, they are concerned both about their general health and their fertility. Irregularities take many forms. Age at onset of menarche, the starting of menstruation at puberty, I told you, or menopause, length of cycle, amount of bleeding, menstrual pain and discomfort, as well as bleeding outside the cycle. Menstrual patterns vary greatly among girls and women. There is a wide range of normal variations, and it is important to emphasize this. In order to reduce the feeling of shame and concern, indeed much educational material emphasizes the normality of varying patterns. However, some of the irregularities may be cause for concern. Yet studies indicate that girls and women may be reluctant to seek advice from health providers. Why this is there is because the menstrual hygiene, the sexual hygiene, and the sexual activity is not being given the equal importance as it is for a male. That's why this is the main topic of concern. Instead, they may resort to self medication. They try to resolve it on their own instead of discussing it with their family or going to a doctor. So, this Womena is the organization which works for the awareness of menstrual health of a female, where they are being told that it is a part of your life, it's a very natural phenomena that you don't need to feel ashamed of, and you need to share it, you need to speak out for it. Therefore, Womena recommends that girls and women are provided with education on both what is normal and what might be a concern. Because when you will be able to know that what is normal and what is abnormal, then only you will be able to decide whether you are suffering from a disease or it is a normal thing for you. National guidelines should be consulted, as should local health providers, to ensure that information provided is consistent. Health providers should actively encourage girls and women to raise concerns. Comments are very welcome, as I have asked you already. So now we have discussed about menstruation cycle, what are the doshas responsible for different menstrual disorders, causative factors, and some recommendations as well. And now we will be discussing about the prevention of menstrual disorders. So there are some tips to prevent menstrual disorders. First is medicine. Second is drink more water to keep yourself hydrated. Apply heat in case of painful periods. Healthy food, because food is the main foundation of your body physically and mentally. Then exercise, because lack of exercise again leads to obesity, and which further lead to a lot of menstrual disorders. Then comes the herbal tea. We'll be discussing it in detail in our upcoming webinars. And so to conclude the webinar, I'll be telling you some of the basic Ayurvedic treatments for the irregular menses. Because this webinar and this whole platform of Pure Bliss Akram is for spreading the awareness of Ayurveda to those persons who need the help of Ayurveda to get treated and get cured. So ultimately, we have to find the Ayurvedic treatment, and it is a must slide for the webinar, for each webinar as well. Ayurvedic treatment for irregular menses. Detoxification to get rid of toxins and inflammation in the body. So detoxification is one of the most common term used nowadays related to Ayurveda as well as Panchakarma. Ignite digestive fire to promote digestion and nutritional sufficiency. As you might have heard that most of the diseases start from your stomach. So you need to work on your digestion, you need to work on your nutritional sufficiency. Because if you are not getting enough nutrition, if you are not getting enough diet, then there is no use of taking medicines. And Ayurveda focus on this thing first and medicines later. Hormone balance to support regular ovulation and boost fertility. We have a lot many solutions, a lot many options to make your hormone imbalance correct and to support your regular ovulation and boost fertility. Then comes the promote mental wellness and stress reduction through Ayurvedic remedies, yoga, pranayama, and meditation. Because you all might have seen that in this busy, hectic, and sedentary lifestyle, people are not taking good care of their own health physically or mentally. And in some countries like India, where women have to take care of responsibilities, both if she's working, then the work responsibility is there. If she's not working, then that responsibility is also there. So in that packed schedule or in that hectic schedule, she's not getting enough time to take care of her health, which leads to these menstrual disorders. And even after that having that menstrual disorder, she's not going to a doctor to discuss about it because of the concern, because she's not having comfort level with the doctor to discuss this thing with their family as well. Then rejuvenation with rasayana to boost immunity and raise energy levels. As Ayurveda says that swasthasya swasthya rakshanam aturasya vikar prashmanam cha. Like Ayurveda not only focus on treating the disease or treating the diseased person, but Ayurveda says that a healthy person should also take care of their health so that they can prevent the diseases. So that part of treating the diseased person is Ayurvedic treatment, either it is medicines or panchakarma. And the second part where we have to keep the healthy person healthy, we have a therapy or we have a treatment called rejuvenation, which includes rasayana and some vajikaran, which works on your immunity. And you might have heard about immunity every time in that COVID period where everybody was talking about the immunity. So this is all about boosting your immunity. Then comes the balanced nutrition with individual specific diet to nurture body tissues. We started with nutrition, proper diet and nutrition, and we are ending with the balanced nutrition. So I think this is the best way to make you understand how important your nutrition is, how important the food you are eating is. It is not only the quantity that is important, it is the quality and the type of food you are eating. So with this, I'll be concluding my webinar for today on menstrual irregularities, and I hope you all have enjoyed it and you all have gained something new from my webinar. We'll see you in the next webinar soon. And if you want to know more about these things, if you want to consult about any of your problem regarding menstruation or any gynecological disorders, you can just visit our website of Pure Bliss Akram and book an appointment for yourself. You can just select the doctor with whom you want to consult and book an appointment, and you will be given a time slot for you. So this is how we have started, and we hope that we will be reaching a very high level soon with our motto, which is pure. So that's why we have just kept the name of our clinic of Pure Bliss Akram, because we are all are trying to work with pure heart to help you out. And in case you need any help from us, we are always there for you. You just need to book a slot, because if we don't want to create a chaos for you as well as for us, because if there will be a proper time slot, we will be ready for that and you also will be ready for that. So that is the best way to consult. So if you want to know about any other gynecological topic, you can just write to us on our website. Your comments are always welcome. And this is all from my side today. Thank you and take care.